All of health is determined by social and economic determinants, and Peoples has gotten that intuitively since the day it was founded. I was inspired by Peoples to become a doctor. My plan was to be a journalist, but I entered into the Peoples world, and Dr. Mark and others in that world really indoctrinated me into the broader concept of health. And thanks to their inspiration, I decided to go to medical school, and the experiences I had at Peoples from day one were the high water mark, and they taught me never to forget that the patient should come first.
What we do is high quality health care, and there is a great need for more of that, and we provide it to people who have little ability to provide their own care, who either don't have insurance or have minimal insurance. And so because that need has grown, Peoples has grown. Our new building at Camino La Costa is an incredible accomplishment for the organization, for the board and the staff. It is allowing us to almost double our ability to serve patients. It is a beautiful facility that is designed specifically to provide patient-centered care, and that's what we're doing.
Our current location in Northeast Austin is centered within the 3 zip codes of the highest number of uninsured Austinites. And so we have every intention and have already begun to be an essential element in this Northeast community to really expand outreach in the way of health education and nutrition education, for instance, in this very kitchen, and be an essential member of this local community as well.
I love the philosophy of People's Community Clinic. People's very much had the most influence on me on patient care and what I thought about medical care. And thanks to administrators, to people that have stepped up financially, we've been able to continue this philosophy, which I think is the correct philosophy for medical care.
To see that people's philosophy was going to be carried on in various aspects of the community was really exciting to me, and it was driven to succeed. It was not going to fail.
My vision for women's health is to build on the great work that's already been done. I strongly believe that the social and economic determinants of health and all of the other factors that affect our patients' lives have to be addressed if we're going to produce good health outcomes for our patients. Back in the day, they had to do rudimentary things like outreach about contraception and outreach about teen pregnancy and outreach about pap smears, because those were novel concepts in the 70s. I look back and in one way, I'm shocked that we haven't made better progress on those problems. We're still having to fight for contraception and teen pregnancy and women's access to health care. But I think that if we stick to our core mission, which is treating the patient with dignity and respect and putting the patient first, regardless of how things evolve in the future, we'll be able to handle it if we stick to those core values.
So there's a new concept that goes beyond the patient-centered medical home, and that's the community-centered health clinic. And that's what Peoples is moving towards, what we look to become.
People's Community Clinic is one of those places where the more you know, the more you love the environment. It continues to amaze me how much People's Community Clinic does for the community around them, and how much they do not only on the health side, which is the obvious part with regard to providing health services, but with regard to the educational aspects of what they provide. That really has been the most enlightening aspect to me, the fact that they not only heal the sick, but they also educate the people that are currently well so that they won't get sick. People's new location and this new facility really is going to allow People's Community Clinic to branch out and do things that perhaps they haven't even contemplated doing yet. It's going to be an amazing partnership between People's Community Clinic and the community that they're now currently in. Being a part of the 46 years lineage of People's Community Clinic is really amazing. It truly is standing on the shoulders of those who made this all possible. And I think the founders would be very proud of what they've done, and I hope that we, as the new advocates for People's Community Clinic, are helping to perpetuate everything that they did and to take it to the next level, because I think that really is our job. The greatest thing about having a great history and a great lineage is that you get to build on that, and I'm proud to be a part of that team.